So today I want to talk to you about whether sodium levels would be increased or decreased in a hypovolemic patient. Now, the reason why I want to answer this question is because I was recently in a Facebook group for nursing students, and I saw somebody asking exactly this. But the problem was that lots of people were giving her the wrong answer, or they were giving her an incomplete answer. But very few of them were offering a rationale. And when people were offering rationales, like I said, they were either incomplete or flat out wrong. And so this poor student was asking for further follow-up from some of the posters, and she just wasn't getting the answer in a way that she could understand. This is why I like to teach nursing students how to study in a way that helps you be able to dig in and figure it out. So let me show you by explaining whether sodium levels will be increased or decreased in a hypovolemic patient. So first of all, the confusion, because a lot of people think, oh, well, it's increased, but then there's dehydration, and what's the difference between dehydration and hypovolemia? And most people were saying, though, that the sodium levels would be increased. However, the confusion comes from the fact that the medical definitions that we are using here, hypovolemia versus dehydration, are very different than the way we use those words in everyday speech. So it's very common to be at your kid's soccer game and say, oh, I'm so dehydrated because it's a very hot day and you're thirsty. But what we really mean medically speaking is that you are hypovolemic. You just don't see people walk around saying, oh, I'm so hypovolemic right now. Okay. But the medical definition for hypovolemia is when your body loses both water and electrolytes, which sodium is an electrolyte, in roughly even proportions. Now, whenever we're talking about electrolytes and normal values, we're always talking about proportions and ratios type of thing, which isn't as scary as it sounds. We're not going to be doing any math here, so don't worry. But what it means is that we're saying how much electrolytes per fluid is there. So that's a proportion, okay? Now, when we're losing some electrolytes, but we're also losing some water, then the relative proportion to those things is going to stay roughly the same. And so that's what happens in hypovolemia. So in this case, if you take the time to understand what's happening on, that basic foundational level, then it makes sense that sodium levels could actually stay normal when you have hypovolemia. So the answer that I would give this student is that for hypovolemia, sodium levels could stay the same. They could be slightly increased, but we wouldn't expect them to be extremely increased because we are also losing water at the same time that we're losing sodium. However, let's look at dehydration now. The medical definition of dehydration is the loss of only water. Okay, so this is true, what we call true dehydration in medical jargon. So it's much less common than hypovolemia is. And it's usually only happens for more severe medical reasons, things like diabetes insipidus or renal failure, some serious conditions like that. However, remember that the sodium lab values depend on a ratio of sodium to water. So since the amount of sodium in your body is staying the same with true dehydration and the water level is decreasing, that means that relatively speaking, we're going to have more sodium per amount of fluid. And in that case, our sodium lab values are going to increase for sure. Okay, so I hope that clears it up. Sometimes, especially if you don't have a medical background, but clearly even if you do, because a lot of people on that Facebook forum were giving wrong answers to this question. But it's really easy to mix up the vocabulary when we use word in everyday speech one way, but we use it medically a different way. I hope that helps. If you would like a reliable place to get answers that you can feel confident are correct because you can understand why, then I would love to have you join me in the Your Nursing Tutor VIP tutoring membership. You can get more information about it at yournursingtutor.com/VIP.